bring in Dr. Calvin Sun. He's attending physician at various emergency departments, including Mount Sinai Hospital in New York. Calvin, thanks so much for joining us. First, these variants that we're seeing really increasing the number of infections around the world. How are they playing out in hospitals in terms of the types of symptoms, the severity of the symptoms, and the extent and duration of hospitalization?
Thank you again for having me. I can only speak on behalf of what I'm seeing in New York City. We are much better at handling this virus. Hopefully after 1 year in, we have enough data now to be able to take on an enemy, sadly at a loss of 540,000 lives. And what we're seeing now in New York City is a lag that we are accustomed now to bracing ourselves for. That there will be an increase in infections and positive rates in testing centers, well walkers, worried well, people walk in and get tested. When they manifest into symptoms bad enough to be hospitalized, that's going to take about 1 to 2 weeks. Remember, 5 to 11 days is that turnaround. That usually people get better before they get worse and then present themselves to the hospitals. Those who are showing up, people who have traveled or exposed to someone they knew that traveled, tend to be younger. Some are reinfections. That's not that common, but it is possible. I think it's around like 1 to 2%. That's still too much for me. And they tend to be sicker the second time around is what I'm hearing. Personally, I'm just seeing sick patients that are not just COVID patients, but also the people mixed in between that happen to have COVID but came from something else, or they're exposed to COVID patients and then eventually catch COVID. So we've been here before. We're just better at handling it. I just think that people are fatigued and caring less, so they're just exposing themselves more. And then we're going to expect death lag in about 2 to 3 weeks, God forbid, unless we change things around.
There's been political and economic pressure to ease some of the restrictions that are in place, and the CDC has announced some changes specifically about travel guidance. Is the science behind that, or is it bowing to the pressures?
It's a balance of everything. When you have seats at the table, I hope you have a mix of different advisors, and then you make a decision that does the greatest good for the greatest number. Ideally, you do everything for everyone. Remember that the healthcare system, we were trying to do everything for everyone, and we had to shift into doing the greatest good for the greatest number, which means sacrifices. In healthcare, that means, withdrawing care. That means, rationing care. And God forbid they have to do that on a macro level in a public health setting. So yes, there are people who are stuck in a place where they are rock in a hard place, where they have to make difficult decisions to appease to many people who have different interests in mind. But if you really think about it long term, how can you have a functioning economy when you have 540,000 deaths after 1 year, let alone people are still constantly dying and not everyone's fully vaccinated? And there's this whole idea we're trying to do this tightrope where people are being vaccinated, but are they fully vaccinated? I think people have conflated the two, where just once you get a vaccine, you can do whatever you want. No, you have to wait at least 2 to 3 weeks after your second dose, which is why I'm seeing a lot of people get infected between the first and second dose, because they think that gives them that false sense of security, and then they get infected and exposed by going to places like Miami and Florida and Texas.
So after that full vaccination, briefly, Calvin, I just want to ask you, after that full vaccination, 2 or 3 weeks, should fully vaccinated Americans still be concerned and cautious?
It depends on those Americans. Out of respect, I still wear my mask, knowing that I'm never had been affected. I never got infected with COVID during the past 1 year of dealing with it. Well, people around me got exposed and died. I assumed that I had some kind of natural immunity protection from eating food off the floor or whatever, my lifetime being vaccinated or just traveling a lot. But I still wear my mask out of respect. And then now fully vaccinated 3 months out, I still wear my mask, knowing that is it possible that I could still get sick with a variant or something in the future I can't predict. That this is COVID in 2020. I can't take things for granted anymore. But that's me as an American. I'm an American, but there are plenty of other Americans who may disagree, who want to reclaim what they have lost or been robbed of in the last year, and therefore they use the vaccine as an ethical justification to do what they want. And I can't control for that. It's really up to them if it fits within their ethical guidelines to do things that may still endanger other people. They could still transmit it, even though data is suggesting that you can't transmit once you're fully vaccinated, which is I wholeheartedly embrace. Yeah. It's still on the fence, and I don't know if you really want to take that risk, especially when the variants are still popping up everywhere, including we have our own homegrown one in New York City. We don't have enough data on that, so we shall see.
Dr.